distancing, containment zones, epicenters, isolation and quarantine are now part of our vocabulary. But what do they all mean? Are people using these terms the right way? Is it effective or needlessly scaring people? Also, understanding home hygiene helps you to clean smarter and to help to prevent the spread of the coronavirus. Now that restrictions have eased and people are out of their homes more, it's important to understand home and personal hygiene. To talk to us about this, we're joined via Zoom by Henry Muchauraya, Marketing Director, Home Care at Unilever, and Dr. Nandipha Magudumana, Founder and Chief Executive of Optimum Medical Solutions. A very good morning to both of you.
Very good morning, Desiree. Thank you for having us.
Morning. Thank you for having us.
Fantastic. Let's talk about the different conversations and words that have come out of this lockdown period that have left a lot of people baffled and wondering, you know, what is A from B? Doctor, let's start with you.
I think it's so important that people educate themselves, especially right now with the ease of the lockdown and now being able to actually venture out and use public transport and be out there. One of the most important things is targeted home hygiene, which is very, very important because I think people need to understand the difference between cleanliness and actually hygiene, targeted home hygiene, in terms of understanding how we can actually break the chain of infection. And that cleanliness is about seeing the visible dirt that we're seeing, and targeted home hygiene is identifying the hot surfaces and spaces in your home to ensure that you are disinfecting any of the microbes that could be on any of the surfaces. So we want to break the chain of infection at home as well.
Mr. Muchauraya, your firm deals with the actual production of these hygiene products. How should we go about engaging with this topic?
Yeah, so thank you. So yeah, very proudly work for Unilever, and in our stable of brands is a couple of brands that have come to the forefront in terms of trying to combat COVID-19. So I think maybe just to start off, I think the conversation really, you rightly pointed out, there's been lots of conversations in terms of social distancing, lots of conversations in terms of the use of masks, lots of conversations around hand washing, and maybe to a lesser extent, less conversations in terms of ensuring that we keep our homes and our surfaces in our homes germ and virus free. I think there's two parts to it. I think the first part, if I could venture into the laundry space, so I think a lot of the work that we're trying to do is to educate and have conversations with South Africans in terms of what they can do. So currently within the laundry space, I think it's advised that you pre-treat some of your garments before you actually wash them. So using a bleach as an example to pre-treat your masks is something that you should be doing. And ideally try and use hot water to wash these garments. So I recommended a temperature of 60 degrees centigrade or above to actually ensure that, when the garments come out of the washing machine or after hand washing them, that they're virus and germ free. And just to echo, I suppose, what Dr. Nandipha was saying is, we have a brand in our stable called Domestos. And recently we've just got some test results that confirm that, this brand can kill the COVID-19 virus in 60 seconds. So this is something that we're using to educate South Africans that they must use it in a manner, in an efficient manner, and also in targeted spaces. So I think this is spaces like the handle of your doors. This is spaces like the countertops where you cut your food. These are particular areas that we need to target and clean as thoroughly as we possibly can to combat this disease.
Dr. Magudumana, you're not only a doctor, you're also a gender-based violence activist. One of the topics that have come out during lockdown is the escalation of the scourge. What are your thoughts?
I think we, because of lockdown and happening and just the tone of the matters of people being at home. There are people who have been identified as being in spaces and places where it is not safe. And I know there have been a lot of talks around groups and organizations coming forward and helping people to actually bring out these issues without also putting them in danger, because these perpetrators are at home and they are with them. So I think it's really, really important that all organizations speak out and they come forward and we look at these matters that are affecting our society.
All right, it's a very important conversation, and we hope to invite both of you back again at another time to continue this very vital conversation. Other matters, as it's a news program, are overtaking events, so we're going to have to end the conversation here. But thank you so much for talking to us this morning, Dr. Nandi. Thank you so much for your time, Dr. Nandi Magudumana and Henry Muchauraya. Let's now